He's 30 years old.
Yeah.
If he's going to wear dentures for the rest of his life, after 10, 15, 20 years, he's going to have no bone, nothing left for us to work with. So that's why it's important to be in the right place to get your implants so that you can be rehabilitated. You can have that beautiful smile, again, in one surgery. Hello, my name is Amar Katranji. I'm a periodontist here in Southfield, Michigan, and today we have a wonderful guest, Dr. Mark McCawley from Fort Lauderdale, Florida. Welcome, Mark. We're going to talk about some wonderful cases today.
All right, thank you so much. It's great to be here, and a little bit colder than Florida, but honestly, great office, fantastic place to be.
Today we're going to talk about our top 5 dental transformations, implant restorations that will really blow you away. And I think what's important to look at is there are many different ways to do the same thing. For instance, here we have a patient who came with a very difficult situation. They had meth mouth. So for many years, unfortunately, he was struggling with methamphetamines, some medications that really started to impact his oral health. He got cleaned up and it was time now to do a transformation. What you can see here, he went from a situation where every one of his teeth needed to be extracted, and we were able to replace those teeth with implants, with dental implants. And this happens in one day. He comes in, put him to sleep, wakes up, he's got a brand new smile. I want to show you one big difference, how we treat patients like this from other places. And this is something that you've probably seen all the time.
We do a lot of as well too. And it is interesting to note, I do see a fair amount of cases like that too, where people get into drugs, get into alcohol. There's different things that happen in their life, and it does impact their mouth. And it's one of those things. Once they get clean, then they realize, hey, this negatively impacted me. I can't chew, I can't eat, I can't smile. And now they've turned their lives around, and they wanna be able to chew. They want to be able to smile, and it's something it's nice to be able to actually help people out with.
And it seems hopeless. It seems like there's nothing that can be done. And a lot of times they'll go places and they say, you need dentures. Nobody wants dentures. We know, what do dentures do for us? Dentures, nobody wants to live with dentures.
No, they're very uncomfortable, especially, I mean, uppers, lowers, they're not fixed on anything. They move around constantly, rub your gums. It's not something you'd want to have unless that's your absolute last resort.
And what do dentures do for your gums? What do they do for your bone? He's 30 years old.
Yeah.
If he's going to wear dentures for the rest of his life, after 10, 15, 20 years, he's going to have no bone, nothing left for us to work with. So that's why it's important to be in the right place to get your implants so that you can be rehabilitated. You can have that beautiful smile, again, in one surgery. And what makes this such a different procedure is that we're keeping his gums. In many other locations, many other these practices that do this, they're going to remove all the teeth, and they're also going to remove the gums. They're going to remove the bone, and then they're going to replace everything with acrylic or with ceramic, but something that's unnatural. What you can see here, these are all implants, and this implant is just replacing, these implants are just replacing the teeth. They're not replacing the gums. These gums, they're healthy gums around these implants, and that's what makes the biggest change for these patients.
That's huge.
Basically like a natural smile.
Yeah, I mean, this is great, especially being so young. You want to try to preserve as much bone as possible, and this is a case that does that. In reality, you can do cases like this that look really, really nice, and you get to preserve your natural gum, preserve your natural bone, and that's something that's great because this is something that you want to last a very, very long time with someone young like that, and you need the bone, you need the gum to support something like that too.
So I know you have another case you'd like to show. Let's take a look at it.
So this is a great case of someone who came in who they actually had severe periodontal disease, a lot of basically older work on their teeth here, and it was going bad, it was failing. So over time, if you don't maintain it, a lot of times you can see some issues happening with these cases. So this is a case where, again, we were able to actually save the lower teeth right here, but the upper teeth, because there was so much gum disease, because there was so much breakdown on those teeth there, we were not able to save them. On the upper, we were able to take out those teeth. Because of the amount of bone that she had lost, we had to replace some of that gum and bone with some acrylic, with some actual porcelain right here. So that's something that looks very natural when she smiles. It's not something where you see any edges or anything like that. We were able to place implants. This one we placed 6 in, and we were able to actually replace it with a nice set of porcelain teeth there.
And a lot of times when people, maybe it's taken a long time to get to the point where they're ready for treatment, during that time, especially if they have periodontal disease, they're losing more and more bone.
Yeah.
So our ability to save the gums might not be there. We might have to do something where we're replacing the gums as well. And that happens. Complications, infections, especially if they have a lot of periodontal infections, there's not a whole lot we can do at that point. However, if you can save the teeth, again, like what you're doing on the bottom, and I think this is such a critical point, is when we can save teeth, we're saving the teeth.
Yeah.
When we're replacing them as naturally as possible.
Yeah, so that's obviously my first goal. As a periodontist, we learn to save teeth, and that's an important distinction between periodontists and different people who are placing implants like this. We're very good at saving teeth when it's possible. When it's not, we're able to replace them in as natural a way as possible. Given the amount of bone loss, we are able to actually replace them with some more porcelain, with some gum right there, but still, when she smiles, it looks fantastic and it looks very natural for her.
And how does she clean this? What is the way that you recommend cleaning these? Because that's sometimes the case. Do I brush? Do I floss? What do I do with these things?
So we go through a lot of oral hygiene instruction with things like this too. So what we'll have them do, we'll have them actually use proxy brushes to get up underneath here, because again, you're not going to be able to floss through these teeth right here. You have to get up underneath the prosthesis. And as long as you're cleaning underneath there, using antiseptics and a water pick, that's something we very highly stress right there. Water picks are fantastic for flushing the actual, any food, any bacteria, anything that gets caught up underneath, able to flush it out. Antiseptics kill any bacteria up underneath there. There's special tips that we actually have for those water picks that are shaped like a little hook that you're actually able to hook up underneath. And there's little tricks and tips that we can provide that'll actually help you to clean your teeth there after we replace them too.
And you have hygienists that see these patients a couple times a year, so they're constantly coming back. And I think sometimes people go to a place, they get their teeth, and they never go back.
Yeah.
And I think that could be a problem, especially with implants. I mean, implants are wonderful, but you still have to clean them.
Yeah. We do see a lot of cases from other offices come back, and they don't look so good sometimes. There's bone loss, there's food getting caught up underneath. I mean, part of it is you need to make a prosthesis that's cleansable. It's got areas to be able to actually clean up underneath. And in some cases, they don't do that, and you do see some issues with those. And we're able to rehabilitate a lot of cases like that too. But it's much better to prevent that from the get-go than to try to fix it down the road, because sometimes it's not fixable.
Yeah, and again, for us, the earlier we see these things, and if we're seeing people every 6 months, every year, we're able to get to this well before it causes any problems. And a lot of times people don't even know. We call it periodontal disease or periimplantitis the quiet disease. People don't know what's happening. And that'll happen if you get your full arch, or if you get your all on X somewhere and they don't see you ever again. The concern that we have is the complications. And we'll talk about that later as well.
So let's look at another one of your cases.
Yeah, so this case came in. This is a really interesting case. This was a lady, wonderful lady. She really wanted to change her smile. She wanted to replace her teeth. And she had went to another clinic, and what they did was they started extracting teeth and they put her into a denture. Now, if you can imagine what the denture does, it starts to flatten out the gums. They had a couple implants in, but things just weren't going the way that she wanted. She didn't like the way the aesthetics looked when she smiled. It didn't look like her. And honestly, she was just very unhappy with the direction that she was going. We ended up taking out whatever she had, that denture, and we replaced it with a set of teeth that maintained her gums. So again, we're keeping her gums. And you can start to see over a period of time, her gums started to shape around the teeth that we gave her. And these were fixed. These were permanent teeth that were never coming in and out of her mouth, and really gave her confidence again. She was sad. She was honestly upset. Like, her whole life she had teeth that were fixed in her mouth. Now all of a sudden she was taking stuff in and out of her mouth, and that really impacted the quality of her life. What she was eating was different. When we gave her this new set, they did not come in and out of her mouth. They were always in her mouth. She was a different person. She became herself again.
Yeah, that's an absolute beautiful case, and it really shows the difference between, a denture and something fixed like this, something permanent that's actually going to stay in. Because, the denture, it does. You saw from previous, it just flattens everything across there. So it's not good for the gums. It's not a natural thing to have in your mouth. and you're able to actually rebuild that natural scallop of the tissue. The gums look very natural there. That's fantastic. And before, she had something that it looks like just plastic teeth in the mouth. It's just this big block of plastic in the mouth, and that's not natural. That's not something that you want in your mouth long term.
And now she can floss, she can water pick, she can get underneath it.
This is a beautiful case.
She's not pulling things in and out, and you can see here the difference. This is what she came in. This is this flat tissue that you're talking about. This doesn't look like a natural set of teeth. This gum here is covered with plastic the whole time.
Yeah.
Now you can see how the tissue is scalloped, how it's shaped to look very natural. And that's really the goal of what we're trying to do, is give people a natural treatment outcome. We don't want people to walk out of here with their grandma's denture. We want something modern for them to feel comfortable
It's true.
and be who they are.
There's patients that come in and they're like, you know what, my grandparents had dentures, my parents had dentures, I don't want that. That is exactly what I do not want. At all costs, I need to have something that's fixed in my mouth. And it's great to be able to do that for people, to actually rehabilitate their mouth and do it in such a natural way and such a healthy way that they're able to clean and maintain for a long time. So this is absolutely a fantastic case. I'm glad you showed it to me.
Yeah, and this is all done in one procedure.
Yeah.
And I think for patients, they get scared. They're like, this is going to hurt. Is this going to hurt, doc?
Yeah.
And my answer to them always is usually within the first few days, they're back to normal.
Yeah. Back in the day, this used to take months and months and months, almost a year to fully rehabilitate a mouth like that with implants. Nowadays, we're able to do it very quickly, within a day or two even. So it's really nice to be able to do that and go from nothing to something beautiful in a very short period of time. So here's something that I just had in my office pretty recently. It's a patient who came in and, like a lot of patients, older, hadn't been to the dentist in a while, he was starting to get cavities on a lot of his teeth. And it was to the point where it was not cost effective to try to save the teeth because, in all honesty, there was not much left you could save. So we had to go to the next best option, which is replacing the teeth with implants. So what we did for him, we were able to save his lower teeth. We cleaned him up. We actually did some periodontal treatment on him, some Lanap on him to actually get his gums healthy on the lowers. And then we were able to replace his upper teeth with a nice new smile for him. And he went from basically this smile right here to something that's actually a whole lot more aesthetic for him. And it's a whole lot more functional too, because he can actually chew, he can actually eat. We were able to replace the back teeth as well, because he had already been missing those for quite some time. That we were able to get him periodontally healthy and also able to get him restoratively healthy too, so he actually had some teeth to chew with.
In these cases, how do you keep them nice and comfortable during those 3 to 4 hours?
IV sedation is the go-to. That way, you put them to sleep there, so they're nice and sleepy. You end up doing it, and honestly, they don't remember anything. You're just calm, cool, relaxed through the whole procedure.
They don't even know
that
that anything happened. They wake up, it's done.
Yeah.
And you can see here, especially as periodontists, our number one goal is to save teeth. And what you can see is he had a situation on the top that it was not the same as it was on the bottom. On the bottom, he could save his teeth. Where else can you go to have Lanap and have all the implants done at the same time? Really, periodontists, that's what we're trained to do, is to save teeth. When we need to replace them, we're able to do both in a very short period of time.
And that's good to kind of highlight, because at the end of the day, it's a lot more cost effective to save your teeth than it is to replace them, as long as it's something worth saving there. So that's a good point, and a periodontist is definitely where you want to end up for something like that.
Yeah, and what I really like about this case is his bite was very off. He had a cross bite here. It's corrected, so it's perfect for him.
Yeah.
And now he has a smile that's going to last him hopefully till the end of his life.
Yeah, that's our goal right there. We want to maintain these implants, because a lot of the clinics that you'll go to, they just place them and they say, all right, see you later. There's no maintenance, there's no follow-up. It's something where it's like a car. If you don't change the oil, if you don't clean your teeth, if you don't clean underneath this, you're likely to have issues, and it's something that we try to prevent as well. So that's another reason to go to a periodontist compared to some clinic down the street. So Amar, tell us about this case. It looks really nice.
Yeah, so this is a case that really emphasizes what we've been talking about. A lot of times we have patients that come in and they've lost a lot of bone, they've lost a lot of gum tissue, and we can still rehabilitate them, but we're doing it in a little different manner. So you can see here, this is what she looks like. You can see in between her teeth, she's got this big black triangle, and here we've eliminated all of that with her teeth. It looks beautiful. It's stunning. She's very, very excited about what we were able to do for her. If we look underneath the gums or underneath the lips, you can see here what we started with.
Yeah.
This is vastly different than what we would like to see. Here you can see a lot of gums that have already been missing. We've gotten a lot of recession, a lot of just bone loss, and you can see there's a lot of bacteria, a lot of plaque building up. My goal would be to try to save this, but we were unable to rehabilitate this case. Like you showed in your cases, you were able to save some teeth. You were able to, in this case, we weren't able to do that.
I was going to say, this case, it looks very, very severe. So this one, given the amount of attachment loss, given the amount of bone loss, it's not going to be a savable case. So this is a great result, though.
Yeah, and you can see here, we weren't able to keep her gums, and we were able to replace her gums in the prostheses in her teeth, so her permanents look very beautiful when she smiles, when she laughs. If we were able to, we would have saved her gums, but unfortunately in cases like this, we're just unable to. So it just kind of hits that point home. If we can see people earlier, before it gets to this stage, even if you're a little nervous, just to understand what we can do at any point, we can help you, but sometimes we have different options for you the earlier we see.
I mean, prevention is huge. Periodontal disease, because that's what caused this right here. Gum disease can be treated, it can be managed, it can be cured. You can actually stop that bone loss before it gets to the point where there's essentially nothing left around these teeth. So that is really, really nice. We can save teeth when it's possible, but obviously if it goes too long, if it goes too far, you're left with plan B, which is a very, very nice plan B, but it's still, ideally, we want to try to save teeth.
Absolutely. And now how do we save this prostheses? Getting her to come back. She comes back every 6 months. She sees the hygienist, just like she would when she had her natural teeth, cleaning underneath, making sure that she's always having her implants checked. And I think, again, that's what we as periodontists want to do. We want to maintain these things. We want to make sure that things get better, not worse over time.
I mean, back in the day, they started placing implants and they thought they just lasted forever. You didn't need to do anything. They're not going to get cavities on them, but you can certainly get gum disease around implants. And that's why it's so important to have a periodontist to be able to monitor this prosthesis, the implants on it, because you don't just want to go to a clinic, they place the implants, they let you go, they never do any follow-up, they never do any cleanings, they never do any checks. You really need to follow up with implants because you can get gum disease on teeth, you can get gum disease on implants, and it actually happens faster on implants. It's more aggressive too. So it's definitely something you want to stay ahead of.
If somebody's out there who really needs full arch, all on X, especially if you're in the Florida area, there's nobody better than Dr. McCawley in Fort Lauderdale. He's going to do the best job. I know, I've seen your work. I mean, this is flawless work, and he's going to save your teeth if you can save them. And just remember that. You don't always need implants, and there's nobody better to save your teeth, especially if you're in Florida, than Dr. McCawley.
And if you're anywhere around the Michigan area, especially close to Detroit, Dr. Katranji is the best. He's got the most up-to-date technology, and he's able to do things same day that would back in the day take 9 months to do. And he's fantastic at it. So if you're missing any teeth, if you've got any gum disease, if you've got anything that needs to be done that a periodontist can handle, honestly, he's the best in the area.
Thank you.
All right. Thank you so much.
Thank you, everybody, for watching today, and we look forward to seeing you in our next videos.
All right. Thank you so much.
Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.